cover as well. Dr. Amar Mashru is with me, who's a junior doctor at a hospital in South East London, and he's been on the picket lines today. Dr. Mashru, thanks for coming in.
Not at all, thank you.
So I suppose the question I'll ask you is the one I asked the BMA's head earlier. What's today achieved?
I think as much as anything, today has been a reminder that the unity in the medical profession, that we just cannot be complicit in this process. We cannot be complicit in implementing a contract or imposing a contract that jeopardises patient care.
You've seen the statements today from the Secretary of State, and they've been pretty consistent again today, pretty firm. No suggestion at all that there's any room for manoeuvre.
Yeah.
And yet, as junior doctors, you've stepped up the strike action. So what's the thinking there?
I mean, from the first day I became a doctor studying medicine, I always assumed it was implicit that health professionals and the government had a shared common interest in improving patient care. We want so desperately to be able to work with government to improve the level of care that we're providing every single day of the week. And yet we're seeing unilaterally imposed, ill-considered policy that shows no signs of any interest in sitting down with doctors and talking about what we need to do to try and improve patient care.
But there's been lots of talking, hasn't there? And it didn't get anywhere.
It's interesting. We need to be very honest about what that talking really involved. That was negotiations under the premise that we would first accept the preconditions. It's not a negotiation, really, in anybody's books. You know, you see Jeremy Hunt offering Mark Porter a few days ago, well, come, we'll sit down, we'll talk. I'm not lifting the imposition, but we'll sit down and talk. Now, these aren't real, meaningful negotiations. They're unnecessary, unnecessarily driven by political ideology.
But you want the contract to be withdrawn in any case, and that's something that politically probably is going to be rather difficult for the Secretary.
Yeah, of course, and I think that's exactly right. And that's what's so sad about this, that it's come down to somebody being afraid of losing face. You know, patient care is something so human, it's so personal to all of us, it's something so real. When it actually happens to us, loved ones or ourselves need medical services. This is something that transcends and should transcend beyond somebody just saying, oh, I'm a bit scared to lose face in front of the public.
Well, I suppose the loss of face could apply to both sides, couldn't it? Because as junior doctors, you've invested a lot now in saying you can't accept this, you won't accept the imposition, you don't like the terms of the contract. It'd be very difficult for you as well to climb down and accept big parts of it. And I'm just wondering now, Amar, really, where you go from here. You've stepped up the kind of action. There are thousands of patients who've been, affected by it. If this action again doesn't yield results, what's the next step? What's open to you then as options after that?
No, it's a fair point. Just the idea of us losing face given what we've invested. The only counter argument I want to say to that is look at the number of people that have continued to join us as this dispute has gone on. We've now got the Patients Association themselves representing the interests of patients, standing up and saying that this contract in its form and in imposition is wrong. We are gaining more and more support the more people understand about what this contract actually entails and how much it jeopardises patient care from August. We can't see worsening situations and climates of the NHS that we have at the moment. It is dangerous. There are not enough doctors to provide care safely at the moment. We cannot see a contract that's going to exacerbate that and make it worse.
But just briefly, I'm sorry.
Yeah, no, of course.
Just in terms of your action.
What we would do now.
Yes, what's your next option?
All I would simply ask is, once again, is just urge the Health Secretary and the Prime Minister to just say, look, let's get very sensible about how we're going to approach this in the interests of patients. Let's sit down and let's talk. Let's remove the threat of imposition and let's have some really meaningful conversations about this.
Dr. Mashru, good of you to come in.
Thank you so much.
Nice to talk to you. Thank you very much. Dr. Amar Mashru there, who's a junior doctor in hospital in